Ms. Kathawala, just curious, I just want to make sure I got some numbers correct. You said that your members collect about $11.4 billion in monies that it then transmits to the federal government for taxes. Is that correct?
Ms. Kathawala, you are on mute.
My apologies. Yes, that is correct.
Do you have a sense of how many of your members or say franchised model owners are new Canadians, like first generation Canadians or immigrants?
It would be a big percentage. I mean, we don't have the exact data, but we do know that. And again, I think it's important to understand that the structure of the convenience store industry, whether it's, the banner flying is Joe's Convenience or Daisy's Mini Mart or Circle K, they are still fundamentally small businesses. And they do employ a lot of new Canadians because that's oftentimes where they get their start, working for a convenience store.
Right, thank you. And you collect all this money from the federal government or on behalf of the federal government or other governments. Like, are you on the finance minister's Christmas card list? Like, I'd assume you'd be an important stakeholder for them.
I wish I was, but indeed we are not. And that is really our fundamental point here is we're not complaining about the fact that we're collecting these taxes. We are complaining about the fact that our members have to dig into their own pockets for collecting those taxes, right? It does seem quite perverse that you have a small business owner that is, $25,000 a year that they are spending out of their own money in order to collect those taxes for government because of interchange fees.
Right. And I'm just curious about the nicotine pouches. Where can I now buy a nicotine pouch? If I can't buy them from one of your members, where do I have to go?
Well, some pharmacies, but based on what we've heard from our members, there hasn't been a big pickup in pharmacies. So what a lot of people are doing is going online, and I might add that that's where youth are going as well. And so a lot of the products sold online are unregulated, they're illegal, they include flavors that are banned in Canada. It's a bit of the Wild West, I'm afraid. So that is why we are so adamant about this issue, because based on recent data that we've collected from our member stores, they are seeing those stores where they had a number of adult customers coming in to buy nicotine pouches have now seen, ever since the nicotine pouches have been removed from their stores, they're seeing an uptick in cigarette sales. So we can see exactly what's happened. Former adult smokers are now going back to smoking cigarettes, and that doesn't seem good for anybody.
Right. But I mean, if you just follow the money, one, the demand doesn't typically go away, although there's some substitution back. But the government's policies are now increasing the black market, or to the extent they're increasing, large pharmacy chains, and actually diverting money and business away from significantly owned businesses that are new Canadians and immigrants.
That is correct.
Thank you very much. Mr. Hatch, do I understand, how many members would you have that would be eligible? Do you know how much money they would get if they were included in the carbon tax rebate?
To your first question, it's about 170. So there's almost all of the credit unions. So my organization represents all the credit unions outside of Quebec, of which there's 185. All but 15 of those have fewer than 500 employees, and so would qualify.
Right. So do you know how much money that would be for them that they could expect to receive if they were included?
Yeah, I mean, it would depend on their size. If you have 499, it would be, several $100,000, all the way down to a much smaller number, obviously, for smaller institutions.
But, they pay utility bills, right? Like, you got to heat these branches. And,
yeah.
Yeah. Okay.
Yes. Yeah. I mean, they're as exposed to the burden of the price as a lot of other sectors that are benefiting. And so, again, it's an easy fix, and the numbers overall are a drop in the bucket compared to the 600,000 small businesses that are going to be getting money in a couple of months.
Why do you think you've been ignored by the government?
Well, I don't think we've been ignored, to be fair. nothing is ever perfect when it comes out of the Department of Finance. I think there was a desire to get this out the door in such a way that perhaps was imperfect. But there is an openness, and I did have discussions with departmental officials in the past few days. There is an openness to making the fix going forward. So we hope that will be possible either in the FES or in the budget in the spring.
That's great. Thank you very much for your testimony. I'm sure we'll get to some other questions from my colleagues. Ms. Yetman, it's wonderful to have you back here. It's been like 3 times in 6 months. I need to thank you for our interaction last time. In fact, the government was so kind to post it for me. I guess, I have a consideration for you to take back. For what it's worth, you might want to survey your members about just some of the items you're talking about, because I had current teachers approach me and say, look, I really like my healthcare plan. And by the way, I also don't like the capital gains tax. Now, that's anecdotal, so I don't have evidence to suggest, but, I'm hearing this back from some of your members. So I just, as a survey or something, if you had, I think that would be super helpful for the committee. As is my custom here in pre-budget consultations, I'll give all the witnesses fair warning that at the end of this round, I will ask you if you have any recommendations for the government that don't cost any money. So you can park that, and as I continue my questioning, you can think about that, and I'll come to each of you by the end of the round. Mr. Cloutier, thank you for being here. Bienvenue. I follow a little bit about the aerospace sector, and in particular, some of the manufacturers who've said that they're concerned about a loss of GDP in the sector through less sales, which will result in fewer workers as a result of the luxury tax. I'm curious as to whether what your thoughts are on that.
Well, in fact, when this tax was put forward, we in Quebec saw it favorably. We didn't think that it would have an impact in terms of decrease in orders or losses of jobs. And so I'm not sure if Simon wants to complete my answer, but it doesn't seem to be a problem for us. I could add to that. I don't have the figures before me, but the revenues from that tax in terms of the aerospace didn't reach the level of the projections of the government, so it wasn't as much as they thought.
Appreciate your candor. That is correct. I think there was only about 400 aircraft that were sold last year, which the tax applied to, which is over $100,000. So it's also possible there might not be selling more aircraft because of the tax, but we'll wait to see as more results come in. Ms. Silas, I agree that agency nursing is a huge problem that ought to be addressed by relevant provincial governments. My understanding is, I just want to make sure I get this correct, within a hospital environment or some other healthcare environment, you could have on the same shift one of your members, a nurse working, and an agency nurse that is, they're making different wages. One gets to pick their shifts, the other doesn't. One contributes to the pension plan, the other doesn't. Therefore, the hourly rate they get is more in some circumstances. Do I understand that's right? You have a divergence of experience within the same healthcare environment?
Yes. Some are paid double, triple what the permanent employees are. The only province that is really working on it is your colleague next door in Manitoba, where they're creating their own public casual workforce.
Thank you. Well, listen, you won't have any concerns from me if you poke more on that issue across the province. There's only one taxpayer, and I think it would make just economic sense. And it makes more sense to actually allow the nurse who doesn't have as much flexibility on shift choice to get paid more, I would think. That's just we seem to have this perverse incentive system that's grown as a result, partially, I'm sure, of COVID and availability of people. But anyway,
Sorry.
you have my support for.
Yeah. And I'll take your challenge.
Yes,
Not
please take
cost-
it now.
Save money, regulate the agencies, save money, coordinate a national health human resource strategy, save money, a patient bill of rights.
Thank you very much, Mr. Hatch. In 10 seconds or less, maybe.
Yeah, our carbon rebate proposal costs zero because it's just allocating the envelope among a few thousand more entities, 603,000 instead of 600,000, let's say. And the streamlined process for credit unions to go federal, OSFI might have to hire a handful of people, so that would be the cost, a few extra bodies at OSFI to help with that process.
OSFI's increased their headcount by almost 50% in 5 years. I think they have enough people. Ms. Yetman.
Well, a couple of things. Voice of teachers should be at the table. For example, the Liberal government does have a future of work table. We were not invited. It would have been nice to be at that table. It's good to be here. But I'm going to say something that you probably won't like. But to me, spending money on education is not spending. It's an investment.
Fair enough. That's well within your right. I'm going to run out of time here. So, Ms. Kothawala, we've already heard from you. I apologize. Ms. Harmonic? Or Harmonic?
Thanks. That's okay. I find you are asking an interesting question given this is a finance committee. And so what I would say was a strategy would be to give land back to its rightful caregivers, First Nations, Michif, and Inuit people, miigwech.
Fair enough. Thank you very much.